what kind of joint is this? So that would be what? Here's your elbow, right? Okay. And then here's, what kind of joint is this? Ellipsoid. Okay. So that's the wrist. So you have two different bowl-shaped things that slide together. Okay. And then what's this one here? So this is pronation, supination, right? And that's the radius. So that's what? Pivot joint. Okay. So then what kind of joint is this? Called socket. So that's, here's your clavicle, I mean your scapula. Okay. So that's ball and socket joint. So that's your shoulder, so it has multi-planar joint. Okay.
Did you make that when you were in school?
No, I just made this over the last couple of months. It took me a while to figure out how to make a shoulder blade. That was the tough part. All right, so now we have talk about individual joints and what contributes to joint stability. Okay? So joint stability, you need your joints to be stable, otherwise they're going to dislocate too easily. Okay? But the more stability you have, then you sacrifice on your mobility. Okay? If you compare the two different ball and socket joints, you have your shoulder and your hip. Okay, which one is more mobile joint? Your shoulder. It has a more shallower ball and socket. Right? So here the socket is just this little labrum right here. Okay, whereas the hip is a deeper socket. So you can't move your hip as much as you can move your shoulder. Okay? You want the joint to be stable, but you also want it to be mobile. Right? So what helps with the stability is the bones are shaped to fit each other. Okay? So you have the ball in the socket, the ball fits the socket. Okay? Then other joints also will fit each other, like in the wrist or in the knee. Okay? So the one shape fits the other shape. Okay? And then if you have a larger area of contact, you're going to have more stability. There's more surface area of contact in the hip joint than there is in the shoulder joint. So it's going to be inherently a more stable joint by the structure. Okay? And then when you change the joint angle, like in the knee, it's not a simple hinge, it's a modified hinge because the two slide. It's not just simply going like this. One slides along the other. So different points of contact are going to have larger areas of contact versus smaller areas of contact. So if you have a joint that has a lot of connective tissue, like the ligaments or also the tendons that can hold something tight, you're going to have more stability. Okay? And then if you have strengthening of the tissues, or like if you're strengthening the muscles of your rotator cuff, that's going to make your shoulder more stable. And then also the muscle activity, if the muscles are firing more, you're going to have stability. Or if the muscles get tired, then it's going to decrease the stability of the joint. Then we talk about two different things for a joint. You talk about a close pack position and a loose pack position. So close pack position is where the surfaces of the joints are in maximum congruency, where they're tied up against each other. Okay? Then the other thing is the capsule around the joint is wound up tight. Okay? And then also, because they're wound up tight and compressed, in maximum congruency, they're going to be compressed together at the maximum point. And then at that point, the joint is kind of in a locked, close pack position, so if you have impact to it, it doesn't have as much give to it. So you're more susceptible to injury in a close pack position. Okay? So we're talking about the knee. The close pack position like this is pretty much standing like full extension. Okay? And so if I get hit from the side like this, my knee doesn't have much give to it. Versus if I'm like this, if somebody's boxing or fighting, they tend to be in more of a loose pack position, so I can take different blows to my knee where it's not in the locked position. And then loose pack or open pack is technically anything other than a closed pack position. But usually in most joints there's going to be one particular position that's going to be the optimal amount of joint laxity or you're going to, sometimes you'll do different testing of that joint. For example, when the shoulder, if you put your arm up like this, how does that feel in your shoulder? Does that feel like it's loose or tight? Okay, so there you're taking those ligaments and tightening it, everything's in maximum contact, okay? And then I go and I can't move it around very much. But if I take the shoulder and it's in this position like this, now I can move things around a lot more versus if it's up like this, okay? That's close back position. So when we get into doing analysis and special tests and things, there are certain tests that you'll do in that position. Like this is the position where most commonly people dislocate their shoulder. Okay? So we'll do a special test that's going to reproduce that mechanism of injury. So it's called the apprehension test. We'll get to that later. But at this point, you just want to understand what the difference is between close pack and loose pack position. Because when you're doing range of motion and you want to check passive range of motion, you want to put the joint in a loose pack position so that you can move it around and assess the tissues more readily in a loose pack position versus a close pack position. So again, there are certain factors that affect the flexibility of the joint. Okay? Again, we like to mention the shapes of the joint surfaces. Okay? The larger contact area is going to be more stable. What other kinds of tissues are in that area? Is there muscle that's supporting it or affecting it, or other fatty tissue? Or like in the other joints, we'll talk about the meniscus in the knee. That's going to affect joint stability. And then what's going on with the ligaments? You know, if somebody has a history of repeatedly straining their ankles, their ligaments are going to be more lax than somebody that hasn't strained a lot. Okay. And then there's different characteristics. Again, if we're talking about biomechanics, different tissues have different characteristics. If you're talking about a certain ligament or a tendon, if it's mostly collagen fibers, how much give does it have? Certain tissues are going to have more, if they have more elasticity or more elastic tissue, they're going to stretch a little bit more, versus other things like tendons and ligaments, you want them to be, you don't want them to stretch very much. And then also, if you're talking about discs, what's the fluid content of the discs? Okay? You probably have heard this before, that when you, at night when you're sleeping and when you get up in the morning, your discs are plumped up with water and they're going to be more, the height is going to be taller, versus as you go through the day, it tends to squeeze the water out, so you're going to be a little bit shorter at the end of the day. Okay, and when at a young age, people's ability to reabsorb that liquid is better than as time and years go on. You don't, your tissues tend to be not as much hydrated. Your hair gets brittle, your skin gets thinner, more brittle things. And when your discs, it's like I talk about it as a grape. Okay? The grape, you can squeeze it, it has some water tissue to it, there's some resiliency there. What happens to it when they get dried out? They turn into raisins. What happens when your discs degenerate? They thin, they lose water, they don't reabsorb water as much, there's not as good of a shock absorber, and then you get degenerative, so it'd be degenerative disc disease, and then also degenerative joint disease. And then also the temperature of the tissue affects it. You know, when you're doing some type of activity, where you talk about, well, you need to warm up, something like that. You know, with weather like this, you don't have as much of